Heart Pro is an advanced cardiovascular offering that covers not only standard lipid testing, but also advanced risk markers, inflammation markers, some cardiometabolic markers, and some genetic testing tied to cardiovascular. The genetic testing in Heart Pro allows us to look at mutations that have certain indicators for cardiovascular disease, and it also allows us to customize that patient's medication to their individual body's metabolism. Standard lipid testing misses a great deal of the population that's at risk for cardiovascular disease. 60% of patients that have heart attack or stroke have a normal standard lipid level. This increases that view to where it can catch up to 90% of patients at risk. Diabetic Pro looks at type 2 diabetes from both an environmental and a hereditary standpoint. We have a prevention and maintenance panel that's looking at standard markers like A1C, glucose, insulin, as well as some other markers like adiponectin and leptin. And the hereditary component of it is Diabetes Predict, which is a molecular test looking at 16 SNPs for mutations that are associated with type 2 diabetes. MD Drug Pro is our medication monitoring program. A lot of times toxicology gets a bad name or has a bad connotation as a drug test. What we're looking for is to make sure patients are compliant with their treatment plan and the medications that they're prescribed. MD Allergy Pro is a serum-based allergy test, which is significantly less invasive for the patient. We're able to do allergy testing with a simple blood draw rather than the skin test, which can be uncomfortable for the patient, take quite a long time, and it has risk of anaphylaxis. So we are able to test for things like food allergies such as peanut allergies, shellfish allergies, insect bites that carry a higher risk. Genetic Pro offers Pharmacogenomics or Pgx testing. This looks at a patient's individual metabolism of certain medications through different pathways. We're testing for multiple different pathways to see if a patient is a normal metabolizer, rapid, or poor metabolizer. And this will allow the physician to avoid any lengthy titration periods or any adverse drug reactions. Hereditary cancer testing looks at 30 plus individual markers and the mutations associated with different types of cancer. It's best used for patients with a personal or family history of multiple cancers to give an idea if they're at a greater risk for those types of cancers. Our molecular department also offers multiple different genetic tests looking at different RNAs and DNAs of the patient for wound, nail, GI testing, respiratory testing. The respiratory testing encompasses COVID testing as well. This looks at specific viral and bacterial markers so that we can identify the exact cause of infection and begin treatment quicker and more precisely. Premier is a unique laboratory in the fact that we offer all of these different testing verticals in one place. A physician can come to Premier for all of their testing needs and know that they're going to get clinically meaningful results from each of those tests.